Again, my name is Dr. John Robinson. We are live at Martinez and Shanken, my good friend Earl Shanken and CPA. Really want to thank you for sending us out here and allowing me to come and speak. We've been friends now for a while here with our business group, and again, I really want to thank you for allowing me to come on out. So, what we have today is this opportunity to learn a lot more about what we do at the Hormone Zone, which really from an educational standpoint, you're going to be able to step back and kind of see a big picture about hormone replacement therapy, about optimization, and how your health can maybe go to the next level. So let's get into that all right now. So better health, better living. I mean, it's a real simple kind of tagline to just kind of give you an idea about what we're talking about the Hormone Zone. We want to take people's health to that next level so they can maybe live a little bit better. Take healthy people and make them healthier. So I am very fortunate, as many of the viewers here on Facebook know, I do work with my lovely wife, Dr. Christina Romero-Bosch. She's also a naturopathic physician, just like myself, like what Earl was just saying. So we're both board-certified naturopathic physicians, and we focus on hormone replacement therapy, but we've been doing it now in a combined 22 years of experience. So not many people can say they can work with their wife and actually really, truly enjoy it. I really do. She's really spectacular. We work amazingly well together. And so it brings that sort of yin and yang to the experience if that's what a patient is wanting or needing. So depending on where they're wanting to go, we've got sort of either way. So that's my wife, and hopefully she's watching right now. Maybe she is. I don't know. She's with the girls right now, and we do have three lovely girls. So, like I was saying before, you can like us on Instagram. We are also known as the Sex Docs. This is just a nice handle so people can kind of understand what this is really all about. And in the end, that's what it often is about. Hormones are sexy. Life is sexy. This is something we say all the time. And so follow us on the Sex Docs. I can also say, please save your questions to the end. That's what I often say, but this is kind of an intimate group here. So if you really feel something's pressing, please go ahead and ask. I love to work off of Q&A. So you can also like us on Facebook. It's the Hormone Zone. I think we're up at about 6,500 likes at this point. So quite a bit of great material just about health, hormones, life, lifestyle. So with the Hormone Zone, what really makes us different, and there are some principles about this, something I think both of us have kind of focused on over the years and developed over the years. So you can go through and do a lot of things with hormone replacement therapy. It's not always going to be a comprehensive approach. So we want to step back and actually look at a full, comprehensive approach to hormone replacement therapy. In fact, this symbol here, the Hormone Zone symbol, actually implies that comprehension. We'll get to that in a little bit. We want to optimize. I just don't want to make it kind of okay. People come in all the time kind of okay. They maybe go to their regular doctor and they say, well, your labs are fine, it's okay, or you're fine. We don't really believe in okay, we don't believe in fine. We want to make things better. So we want to optimize the situation, optimize your health. I believe that the next level means, for your health, for anything in business, whatever it might be, what got you here will not get you there. What you're doing right now at this particular moment won't necessarily take you to where you want to go. Often it has to be something maybe even radical, maybe a little bit more of the same thing, but often it just has to be something a little bit different. And peak performance, so this would be the other principle and the big difference. We're focusing on that idea of peak performance so people can do exactly what they want to do. You're all athletes in here the way I see it. So, and what I mean by that is that sometimes people are actually exercising like an athlete, but the average person that's coming in to see us is really kicking butt all the time, or they want to be able to kick butt all the time. And there's an athletic kind of thing going on with that. People are parents, or they're working more than 40 hours a week. They want to be able to really, really peak perform, and that's what the Hormone Zone offers. So here's the 5 key differences. I put this into a PowerPoint so I can already start to see some of the differences from using a Mac. But we're going to focus on sex hormones. So saying that before, sex hormones just doesn't mean sex, although we're going to talk about sex. That's a lot of fun. But we're talking about gender hormones in this case, estrogen and testosterone. We'll talk about insulin and digestion. This is a passion of ours for sure. And thyroid, probably the biggest passion that we have, is thyroid and undiagnosed thyroid disease. Adrenals and stress, because I'm sure nobody in here has any stress issues, nobody watching has any stress issues, and growth hormone. And so, again, that's what that symbol means, and you can see how they're all sort of interrelated. One is helping the other. One's not necessarily more important than the other. We have to look at it in a comprehensive fashion. So let's start with thyroid. really something we're amazingly passionate about at the Hormone Zone. We've developed our own unique system called ThyroZone. This is a trademark system of how we diagnose and treat thyroid disease in a very unique way. And I really like to talk about the thyroid as metabolism. And actually the word metabolism comes from the Greek word metabole, which means to change. The word hormone literally means to change. So this is about changing, about taking things to that next level, making it a little bit more than what you thought it could be. Our second book just came out, ThyroZone, just came out a couple of weeks ago. We're very happy and proud about this. So you can get it on Amazon and really understand a lot more about the detail behind what I'm getting ready to present right now. This is a labor of love with all of this. My first book was about a 500-page book where I talked quite a bit about thyroid, but it was called The Hormone Zone. So it was this comprehensive approach to everything. In this particular book, we really focus it in on the people who maybe think they have a problem with their thyroid, who've always suspected it, or maybe asked a particular doctor, do you think I have it? And they said, you're fine. So we're often providing those answers that people aren't really getting, and certainly the solutions to be able to get maybe the dosing of their hormone, maybe they're already on something, and maybe helping that, taking it to the next level. So what are some of the symptoms of low thyroid? There's a lot. We call the thyroid the great pretender. It does all kinds of things. It mimics all kinds of things you might be thinking you have right now at this moment. But memory and focus and anxiety and all kinds of gastrointestinal upset, hair loss and losing your eyebrow in the outer 1/3, fatigue, cold hands. My first examination for most patients is when I shake their hand. So I've shaken a few hands in this room, and I was already getting an exam right there. Just cold hands is really something very common. But it also very well could be something related to your low metabolism and low thyroid. You know, one of the things that if people suspect they have a thyroid issue, or if they're wondering about it in some way, one of the biggest reasons why we see low thyroid is Hashimoto's thyroiditis. It's an autoimmune process. So gluten sensitivity is the #1 reason why we see the autoimmune process, and then therefore why we see low thyroid in this country. And so what we're wanting to always do with how we're treating things with ThyroZone, and with anything we do at the Hormone Zone, is treating the cause. In naturopathic medicine, we call this tolle causum, or treat the cause. So we want to get down to the root of it. Because I can do all kinds of fancy things maybe with hormones, but that might not actually be getting down to the root cause of why you have the issue. And you might not get as well as you otherwise could. Two big problems with thyroid hormone treatment. And this is something that we've kind of distilled over the years. And they are pretty simple. #1 is it's the wrong type of thyroid hormone. So a lot of people are on thyroid hormone. It's about 30 million people have some form of thyroid disease, and we think that it's actually higher than that. They're just undiagnosed. But we've got at least 30 million people with some form of diagnosed thyroid disease. And they're often on, and that most of that is low thyroid, hypo-low thyroid. And so they might be on a standard synthetic form of thyroid hormone medication, and it's normally the wrong type. It's normally not the type that's going to help them with their signs and symptoms. The right type, in our particular opinion, is something that's natural. So this is a prescription medication, but we bring forward those options of something that's natural. Nature-Throid is one of the most common ones that we prescribe. So the second problem is that maybe they get the right type of thyroid hormone, but they don't get enough of it. And the reason they don't get enough of that thyroid hormone is because most doctors are beholden to this TSH test. And I don't know, maybe some people in here have seen this TSH test and they're aware of that. We call it too slow to help because it's called thyroid stimulating hormone. It's the #1 run assay of all blood assays. But it doesn't necessarily let us know what's going on with someone's metabolism and whether or not they need thyroid hormone or whether or not they need more or less. But most doctors put all stock in that particular lab value. And then therefore, in our opinion, what we've observed over the past decade is that people go suffering. So we're not into suffering. So we want to be able to provide those answers beyond simply just that test. One of the things that we provide is an examination of your metabolism. Again, it's all coming back to metabolism. It's a really cool test called the Thyroflex. And what it's doing here, you can see there's a little reflex hammer. It's kind of thumping her right here on her elbow, and it's making her wrist move. All of your reflexes are associated with thyroid function. We've known this for over 100 years. If we bang on a reflex and it goes slow, low thyroid. low metabolism. If we bang when it goes really fast or too fast, it would be high thyroid or hyperthyroidism or too high of a metabolism. So it's a really, really cool test to be able to understand what's going on. It's called Waltman's sign. I mean, it's, again, we've known about this for a long time. This is just taken that idea that they've been doing since really the early 1900s and put it into a computer process to be able to see to the millisecond how fast it's moving. So that gives additional information about what's going on with your body, not just about what's going on with the blood test. This is probably even more of the gold standard. This is a resting metabolic rate test using something called indirect telemetry. All this is doing, you lay down, it's a really easy test. She's just breathing through this tube, and the machine is measuring how she's consuming oxygen. And that will tell me extremely accurate. There's a 99.9% accuracy of what's going on with metabolic rate, exactly how many calories your body is burning at rest. And if that is low, then we can basically deduce that there's low thyroid as well, depending on other factors. So it gives us that additional information, additional clues to what's going on to be able to diagnose low thyroid and certainly be able to monitor it, to be able to drive the dose to the points where you actually have relief, which is what most people who are dealing with thyroid hormone treatment, they don't ever get. So comprehensive care is really the take-home message of what Thyrazone offers. So let's talk about another section here, adrenals. Life energy, I really like this one too, because this is about stress. And I think that's, it's inevitable. It's like death and taxes. It's coming no matter what. Stress is there. So yeah, it's something that we hear about. I always say that I talk more about stress at my desk with my patients than I do anything else. They come in thinking it's about thyroid, or it's just about thyroid, or it's just about something else with their health. And in the end, it just comes down to this. Even chronic diseases we're finding are really just in the end coming down to some form of stress. So what happens is that you've got these little adrenals, these small little glands that sit on top of your kidneys. They secrete adrenaline, hence the name adrenals. They secrete cortisol and all kinds of other hormones. But that stress hormone, cortisol, is one of the big things it secretes. And what happens if we're under all of that stress too long, that all starts to become dysfunctional. That organ starts to become dysfunctional. And it can present in all kinds of ways. Feeling that sort of helpless and despair, cravings thing. I've probably been in that bathtub once or twice before. And feeling defeated, obviously fatigue. These are the things that just kind of come up with that. So I really like this one too, the 4 phases of adrenal burnout. So eventually what happens is these little organs, they just kind of get burnt out. After that much stress over a certain period of time, it can't do it anymore. And so this diva, supernova diva, this is someone who first starts out. They're first in the midst of the stress, and they're performing. They're doing no problem. It's fine. But eventually what happens, they go into either 2 phases. This is like the second phase, and this will be the final phase. They can either become wired or tired. I'm tired, but I just can't get to sleep. I want to sleep, but I can't. I turn on like a light bulb right around 10 o'clock. That's when I want to go run the vacuum and go wash the car. But when I wake up in the morning, can't get out of bed. And that can present in a couple different ways. You become inflamed, you can become allergic. The adrenals have a lot to do with what's going on with the immune system and balancing that out and whether or not someone might be suffering from the air they're breathing out there. And then finally what happens, if the stress goes on long enough, you just become burnt out. And that can be critical. So this cortisol rhythm, what we do to be able to figure out what's going on with the adrenals, we do a salivary test. It's a really cool advanced test where you're just spitting in these little tubes 4 times throughout, maybe 5 times throughout the day and into the evening. And that'll show me where your cortisol, that main stress hormone, is. Again, in the morning it should be nice and high. That's what gets you out of bed. It should be nice and low in the evening. That's what allows you to be able to go to sleep. But for a lot of people, it's all screwed up. They're maybe jacked up all the time, and we can see that. We check the test, and it's always high. Or maybe they're always low because they're in some kind of critical burnout. Or, which is very common, it's low in the morning, they can't get out of bed, and it's all high at night, and they can't get to sleep. Plenty of cortisol. They're secreting plenty of the hormone. They're just not secreting it when they should. So we can determine that, and then through natural means and hormonal replacement, be able to manage all of that for you and get you to feel better. So with this adrenal repair, a lot of it is stress management. It's definitely about balancing out blood sugar. I think it's probably one of the biggest things. people often that have some kind of adrenal issue normally are skipping meals, normally say to me, you know, ever since blank, I was never the same. Death, divorce, you know, 80 hours a week working, whatever it is, eventually it just starts to tax people. So we go through that process trying to understand that. And then sometimes there are actual hormonal replacement things that go on as well with our repair. But it's comprehensive in its approach as well. So we want to make sure we're balancing those stress hormones because it has so much to do with why you're feeling the way you're feeling. Growth hormone. Love this one. So one of the main things that we focus on at the Hormone Zone, something that's part of our trainings, we focus on age management, restorative medicine, regenerative medicine. So this is that anti-aging approach. And growth hormone just happens to be one of the most important hormones when it comes to anti-aging. So where does this growth hormone come from? You've probably heard about growth hormone before. It comes from your pituitary gland. It has a lot to do with how allowing you to grow and develop and all of this. It's vital. But as adults, we need it as well. It comes down through the body and goes into something called IGF-1. That's what we actually measure in the blood, is something called IGF-1. Here's our first little graph here about what happens to some of these hormones as we get a little bit older. What happens is that IGF-1, or that measurement of growth hormone, just really starts to decline. And the big time where it becomes the most critical for most people is 50. 50 is that magic time. This is the time where you see menopause. This is the time where you see growth hormone going down. It's definitely when you start seeing low thyroid. And low thyroid is also, by the way, 8 to 10 times more common in women than it is in men. And it's more common in women who are right around 50. Men start having their issues largely right at 50. So 50 is this magic kind of mark, just physiologically just sort of happening. Things happen before that, but 50, you better get your mind right.
Oh, downhill from there.
Well, it's about choice. It's about decision. And what's great, at 50, you know what that means. You know how to do it. People walk in at that point, they know what they want, they know what they need. They just maybe need a little bit of guidance to be able to get it. So growth hormone does all kinds of stuff. It definitely helps with muscle and bone. These are some of the common things. But among all these other things too, it helps with your sleep. It helps with your recovery. Growth hormone is about recovery. So when our growth hormone starts to go down, that's why it's harder for us to recover from, you know, exercise, or it's harder to recover from working like we used to be able to get away with it. We could burn the candle at both ends before, now we can't. So one of the things that we provide at the Hormone Zone is something I'm extremely excited about. It's called peptide therapy. Now maybe you've heard of growth hormone therapy, you know, athletes out there using it and all of that. And we will, depending on the patient's age, normally people well into their 60s or 70s, we might actually give growth hormone. But most patients who might need some level of growth hormone stimulation, we use something called peptide therapy. So it's far more natural. It's still by prescription, but it's just a small little amino acid peptide, a little protein that will come up and communicate to your pituitary to say, make more growth hormone. So it's a far more gentle approach with basically virtually no side effects. So that's one of the big things we really like to do. And there's a whole world of something called peptide therapy, and this is only scratching the surface. So some other innovative things that we're constantly doing at the Hormone Zone. And so once you start on this kind of peptide therapy to be able to enhance growth hormone, sleep is probably one of the first things people start to notice. And then body changes and skin changes as well. So aging optimization. We're all going south. We just want to put you in a Cadillac instead of a Yugo. That's kind of the way we look at it. So how are you getting there? Insulin. 86 million people in the United States have pre-diabetes. Insulin resistance, pre-diabetes. The shocking number, to me at least, is that 9 out of 10 don't know they have it. So people are walking around with this sort of pre-diabetic state. Why? Maybe because doctors aren't really looking at it in a tight way, because they're getting used to seeing people slightly being off. So they're just saying, well, that's fine. And it's also that we're all becoming a little bit more accustomed to having these issues. Being focused on carbohydrate, being allowed to be sort of overweight and thinking it's okay, meaning thinking it's not pathological. but ultimately it's the beginning phases of that. So we see a lot of pre-diabetes, and we're treating that, which I think is great because we're catching it before it becomes something too serious. So I really like to mention this too because there's many things that go on with pre-diabetes, with metabolic syndrome, these sort of fancy words for pre-diabetes and diabetes. The two things I really like to focus on are dementia and cancer. We talk about, problems with, the liver and heart and all of that, but we forget that all that extra sugar, all that extra glucose in the blood feeds cancer, and it leads to dementia and Alzheimer's disease, even when the blood is slightly off. So we've seen studies with this now where it's just slightly out of the normal range your doctor would normally look at. And it's just out of it, and they decided to study those group of people. And they found, there's several different studies, but they have found that it's increased your risk for dementia and cancer to be slightly out of the range. So for us, we're not into that. We want to optimize the situation, prevent these things from happening in the first place, and all the other things that go along with it. So one of the things that will, and this is just one example, we look at the ketogenic diet. I'm sure people have maybe heard about this lately. We've been talking about it for a long time, but it's becoming that much more of another fad diet. However, there's nothing new about it. Our ancestors used to eat this way. There's nothing radically new about this concept. We've been understanding it in a modern sense since the 1800s. But essentially just means keeping your fats high and your carbohydrates low and your protein moderate. And it's fantastic what this can do, not just from a weight loss standpoint, but all kinds of things. So what we're really seeing, which I think is one of the most exciting things about it, it's helping from a neurological standpoint. So chronic fatigue syndrome, Parkinson's disease. They did a lot of studies with this in the 1920s. They were using the ketogenic diet at the Mayo Clinic for children who had epilepsy, but they weren't responding to the drugs of the day. And so if they put them in this ketogenic state, meaning keep the fats really high, carbohydrate very low, they wouldn't have seizures, or it would drastically reduce. So this was used quite a bit at that time. And then new drugs keep coming out, and this kind of went away. Back in the 1990s, there was a woman who had a son, Charlie, who had issues with his epilepsy, and they couldn't figure it out either in terms of the drugs. Also, even in the 90s, weren't working well for him. So she kind of dug into the research and said, wait a second, they were doing this back at the Mayo Clinic, and they were successful. Why'd they stop doing it? And so it kind of came out. Then she created the Charlie Foundation. Charlie now is well into his 30s at this point. So it's a pretty cool story about what it does to the nervous system and what it does for performance. They use this in the military. I mean, when they start studying in the military, there's something probably to it. There's more performance, and we're seeing athletes using the ketogenic diet. Low carbohydrate. For athletes that are bikers, that are biking hundreds of miles, you must have carbohydrate. No, you don't. They're proving that you don't. There's all kinds of great research with it. So just one example. So someone might want to do this, they might not want to do that. There's a lot of ways to help someone. It doesn't have to be this, but I like to bring it up. So diet and weight management really is this overall concept that we're bringing to you as well. This part of that comprehensive care. We have to look at those things too. So sex hormones, one of my favorites for sure, the creation of sexual energy, or the idea of sexual energy being about creation and co-creation. So menopause, low testosterone for guys. So there's all kinds of things that come up with menopause, or let's start with women and say menopause. So anxiety and depression, and mood swings and irritability, all kinds of things that start to change. You have menstrual irregularities, energy problems. The big three down here, this says osteoporosis, diabetes, and cardiovascular disease. Those are the three big chronic diseases that come up as hormone levels go down. Both estrogen and testosterone for women, or testosterone for guys. These are the big three. So we want to make sure that we're optimizing these hormones, not just so you can kind of feel awesome and have a libido again, but so where you're actually preventing disease. And that's what's pretty cool about it too. Women have testosterone. Women have more testosterone in their bodies than they do estrogen. This is something that's often not discussed, but ounce for ounce, pound for pound, you've got more testosterone floating around in your blood than you do estrogen. So if it starts to go deficient, that can become a problem. And here's just some of the things. So it regulates your immune system. It's helping with memory and focus. It's also regulating mood. Has a lot to do with incontinence. We're strengthening the structures around the vulva and around the urethra, so coughing, laughing, sneezing, jumping rope, all that becomes a little bit more strengthened because of the function of testosterone. So it's pretty cool how that works too. That's the big heavy hitter, I gotta say. I always say that if I had to choose between estrogen or testosterone for all my female patients, I would choose testosterone. I have some that would beg to differ with me with that, because estrogen has its own amazing benefits as well. But testosterone is a big heavy hitter in helping most people in a broad stroke. So yeah, guys have issues as well, for sure. Let's talk about that. We don't want to leave the boys out. So yeah, I think we talk about libido and energy and all these kind of things and weight changes, but I think one of the big key things that you see with low testosterone in men is a lack of motivation. This happens in women too with testosterone, but I think it's something really key with guys. That desire to want to get it done, whatever it is, it just starts to go away. It starts to move a little bit. You don't feel like getting off the couch. That same vim and vigor you had maybe for career or other things in your life or hobbies or whatever, that just starts to maybe go away a little bit. Testosterone brings that back. I'm really passionate about this too. I just got back from London. I presented at an international congress on naturopathic medicine about the global decline of testosterone and sperm in men. And it's a global problem. And we're seeing 3 generations of data of sperm lowering and testosterone lowering. And it's a problem. It's a problem physically, but there's even problems perhaps from a social standpoint as well of what's happening out in the world. That maybe we could say some of that has to do with the lowering testosterone in men globally. I encourage you to go to my website to check out. I wrote a 50-page paper, 30 pages plus 20 pages of citing on that particular topic. It's really something that's a problem, and there's ways to fix it. And I feel like I love to champion that cause to be able to help that. So testosterone goes down. When? When does it become critical? 50. It just what happens. It doesn't mean it can't be low prior to that. In fact, again, I've been doing this 11 years. When I first started, I didn't see as many 20-year-olds as I see now. You just see more and more low testosterone. So it happens early. But again, 50 is this sort of critical mark for a lot of men. So we want to optimize the range, 7 to 1100. The range can be huge, like a 200 to 1100 kind of range. So you're a 201 and the doctor says, you're fine. And you have all the symptoms, and that's not fine. We want to optimize something that would be reflective of someone in their 30s. And that's where you function your best. This is a real big, busy kind of thing here, but what it's talking about is what happens as the testosterone levels go down in both men and women. It's talking about the ranges. So women, by the way, have about 1/10 the amount of testosterone as men. It's still very important for their bodies, but it's important for both men and women. Guys just need more of it. But as the levels go down, we see in the research how things, Alzheimer's disease and prostate cancer and all these things and breast cancer, those risks go up as hormone levels go down. So by the time we get down in these ranges here, it becomes critical. We get diabetes and complete erectile dysfunction, coronary artery disease, etc. So I feel like part of what we do is an optimization thing to help prevent disease. So one of the big things that we focus on is in the type of hormone that we provide, let's say for menopause or low testosterone, is a natural form, something called a bioidentical form of hormone. So another way we want to think about this is how do we put the hormone into your body? And there's many different ways to do that. We have creams and gels, and there's patches, there's oral forms, and then these little pellets. And that's something that I really find to be one of the most superior ways to put in hormone, particularly for women. Pellets are pretty cool. They've been around since the 1930s. There's nothing new about it. Since 1937 in Europe, since 1939 at the University of Georgia at Augusta, it's been used a lot. And I worked at a very busy practice that largely focused on this, and that's where I got a lot of my training. But we've kind of taken this whole concept even to the next level, how we comprehensively look at it. But pellets in and of themselves are very powerful. And so I numb a little area in the side of the hip, and we place a small little instrument that places the pellets just underneath the skin. And then it just secretes the hormone 24/7. Can there be complications? Yes. Is it really rare in women? Yes, very rare in women. When I first started doing this, I'll tell you, no one was doing it. And now it's like Circle K. There's one on every corner. So everyone's doing it. Doesn't necessarily mean they know what they're doing, with all due respect. So that's just, it ain't rocket science, but it's not as probably complicated as taxes in certain ways, but there's definitely an art to it. And that's just experience. When I say I've done this thousands of times, it is not at all an exaggeration. I have done it thousands and thousands of times with massive success, and it's pretty cool. But it's not perfect because nothing in medicine is. One other way we can go about putting in hormone, and I think this is a really cool option, particularly for men, are injections. Now, we can do this in women too, but we largely do this type of therapy with men, where we're taking a testosterone injection and we're putting it into the fat in the stomach, where typically it's given like right in the butt. So we've kind of turned that upside down. Putting it into the fat allows that hormone to be more consistent in its level, more consistent in its delivery, and therefore more consistent in how you feel. Plus, we do it 2 times a week instead of once. So we take the same dose that might typically be given per week, and we split it in half, and that also gives a better pulsatile result. And guys just feel better. And again, we can do this with women as well. So that's what this is implying here, that we've kind of done a lot of labs with this, and we don't do as many labs as we used to because we really figured it out. But we were able to keep the levels very consistent with these types of injections. So, the O shot. Does anybody here know what the O shot is? Would anybody here care to venture to guess what the O shot might mean? This is the orgasm shot. Dr. Charles Runnels out of Alabama, about 7-8 years ago, invented this particular procedure, and it's pretty nifty. And if you could do it for girls, you can do it for boys. It's also, there is a P shot. I'll get to that in a second. So the O shot helps with orgasm. It helps with incontinence. Again, coughing, laughing, sneezing, jumping rope, running on the treadmill. After a couple, 2, 3 kids, things start to change. It strengthens the area. And actual vaginal regeneration with the tissue. There's studies with this. We have biopsy studies showing what the tissue looked like before and versus what it looked like after. So what are they using in order to do this? It's pretty cool. Oh, well, I'm sorry, I got to talk about the P shot. We don't want to leave guys out. So the Priapus shot, that's just a fancy way of just trying to say penis, but we can say penis here. Improved erectile function. It's bringing back a restoration to blood supply for the penis. Sensitivity, and men get the bonus of about a 10 to 20% increase in length and girth of their penis. Yes, Facebook, I just said that. It's true. So, normally guys are saying, where do I sign? Just a quick side note, and this might be good. They've done studies with this. These are mostly just sort of questionnaire type of studies. Men believe that their penis needs to be larger. But when they've actually asked women this, they don't actually think that. So it's really more guys have this sort of obsession over it, far more than women do. With that said, in some cases, it still might be medically appropriate. So anyway, what are we using here? How are we helping with the O and the P shot? What we're using is something called PRP, platelet-rich plasma. So what this is, we draw your blood. We spin it down in a very special tube, a proprietary tube. Yeah, right? So you didn't know what you're getting into today. You didn't know.
Medically appropriate.
Okay, let me speak to that. Sometimes what happens, as men get older, the penis starts to shrink. As women get older, the vagina starts to become looser. So it's, things aren't meshing the way it used to. So we can technically say that's medically appropriate. I mean, in that particular example, but yeah, no, it's funny nonetheless. Anyway, this PRP. So we take the blood and we spin it down, and it separates out the red blood cells from the platelet-rich plasma portion of your blood. It's like the serum portion that has over 30 different growth factors in it. Maybe you've heard of this being used for orthopedic reasons, like injecting in your knee. Hein Ward from the Pittsburgh Steelers back in 2005, he had it done on his knee, and then they won the Super Bowl that year, and everyone, there was an article, and he said, yeah, I did the PRP and I had it injected in my knee. Tiger Woods has done it. Many other famous athletes have done it. So PRP has been used for the past 20 years in orthopedic settings, but now we're starting to use it in these other settings. So it's extremely safe. It's your blood. You can't reject it. There are no known side effects to it. Again, 20 years of use in orthopedic settings, there's never been once a rejection or a problem with it. So we can take this very regenerative, safe substance and inject it back into the body. What are we looking at here? That's the clitoris, right? Because what we're used to seeing is just this portion. But the crus, or the legs here, actually come through and surround this is the vagina, and that's the urethra. So it's pretty cool. I love that picture because it really shows you what's going on. For men, a lot of this, actually men have a crus as well going through with the penis up underneath that you can't see. But a lot of what's happening for women is inside. So we can affect all these structures with the PRP. First of all, when we do this procedure, you are very, very numb. I numb you 3 times over before you ever even get the actual injection that winds up going right next to the clitoris. So the clitoral body, we say. Again, you're very numb. I know people start squirming in their seat. It makes sense, but you're very numb. It's a 0 to 2 out of 10 on the pain scale when it's done correctly. And again, back to what we were saying, not everybody does it correctly per se. I have been trained specifically by the man who has invented this, and so we're licensed to use the O and the P shot very specifically. There's other people out there doing it aren't necessarily doing it the optimal way from the person who invented the whole procedure, and they might not be getting a 0 to 2 out of 10 on the pain scale, but we do. So again, the other injections, there's 1 injection next to the clitoris and 1 just underneath the urethra. And this often for women is 1 and done. Not always, but often. The incontinence issue is an 80% success rate with over 10,000 procedures recorded with the group that I'm a part of, and it's a pretty huge success rate for any medical procedure. And again, you can also inject it in the labia as well. There's a condition called lichen sclerosis, which is an autoimmune condition, a very difficult autoimmune condition for women, and the plaques that will form on the vagina, and they can help with that as well. So, again, we don't want to leave boys out here. There's that crus that I was just talking about. That kind of goes deep underneath the pubic bone. But anyway, for the P shot, you get a very good dorsal nerve block, it's called, which is kind of the same kind of anesthetic process they would do if you're going to do a circumcision or something like that. So you're very numb first, plus before even that, you also had an anesthetic cream placed. And there's 4 injections on either side of the penis, and also 1 in the glands. And it's amazing how it works. One of the bonuses that guys get, so as soon as we do the procedure, a penis pump is placed. So you wouldn't think that a penis pump is medical. It's very much a medical device, at least how we use it. And you place the penis pump, and this helps to keep the PRP in the area of the penis. And then men are encouraged to take the penis pump home and go do exercise. So it's exercise for the penis with the growth factors that are there being able to do what it's going to do. And most men are having great success even after as little as 6 weeks. And they do the penis pump exercises for 10 minutes, 2 times a day for 6 weeks. It's pretty cool how it works.
Bring it to the office.
Yeah, well, and we have like a big brown paper bag, so they get to walk out up front with the brown paper bag with their penis pump in it. But yeah, so take-home message here is that we're using hormones and we're looking at sexual regeneration, and there's a lot of different ways to do that. By the way, back to the incontinence thing, most women, if I give them estrogen, if they're in the menopausal range and I give them estrogen, incontinence is almost invariably a slam dunk because we use pellets. So a lot of times doctors are using other forms of hormone replacement therapy, but they're not using pellets, and pellets keep that estrogen consistent. They change the state of the vulva so much more superiorly than other forms like creams and gels or patches. So we're able to kind of restore that far more efficiently. So a lot of times I don't have to necessarily do the O shot, but sometimes we do. So this is kind of that comprehensive idea, bringing it all together. It is about these 5 key systems and more. That comprehensive care is something that's really important to what we're providing. We want to optimize you. We want to take your health to the next level. So that's it. Thank you very much. So thank you. Do we have any questions? Someone's got to have a burning question. I can only imagine. Oh, we were just, you know what? This happens to both men and women, but I'll pick on the guys real quick. Guys will write in their new patient paperwork that they have erectile dysfunction. They will then sit across the desk from me and I'll say, very gently, so how are things going with your erectile dysfunction? What erectile dysfunction? What are you talking about? I don't have that. So, right, yeah, it's right here. Or they'll say, well, no, my wife wrote that down. So, but yeah, that happens to women too. So, anything at all? All right. So that's pretty straightforward. Oh, you missed it.
I was watching you through the window.
Oh, great. Okay.
I didn't want to interrupt you.
That's okay. So again, thank you very much. I appreciate your attention. It's just fun to come down here and talk about it all, and I just love you, Earl, to death. So thanks again for having me. Thank you.
All right. Thank you.
Yeah, thank you.
That was really good.